My name is Howard F. Spegman, and I'm a physician at Crone Clinic and here in Black River Falls, and I've been at the Crone Clinic for about, coming up on 14 years. Came here by way of actually Kenya, Africa. Before then was in a mission hospital for a year, and then before that practiced in California for about 9 years. I went to medical school at University of Washington in Seattle. Before that I got my degree in geology actually at one of the state colleges in New York, and actually worked as a geologist for several years before going into medicine. We were looking for a rural environment to raise our 3 children, and I had thought of Alaska or Montana, as I was a geologist in Montana especially. But Crone Clinic was very aggressive about job opportunities for surgical obstetrics. I do cesarean sections and other things, and my wife and I interviewed before going to Kenya, and we saw no reason not to sign, so we actually signed to come here even before going to Kenya. And it's been a very excellent place to practice. The patients have been good, my colleagues have been good, so it's been a real excellent choice. Well, my wife and I love a couple of things. We're avid tennis players, and we also are divers, and we got certified here in Black River Falls, and we usually try to go at least once a year to the Caribbean, and bicycling, and I like photography and writing as well. So most of us are very conversant with, again, hypertension and diabetes and congestive heart failure, COPD. I do surgical obstetrics, cesarean sections, postpartum tubal ligations, and do call coverage for that. So I think OB is an interest area as well. And then vasectomies, so contraception and those kind of things. Those are interest areas. Well, I think standard of care, if people have a myocardial infarction, acute coronary syndrome, they need an interventional cardiologist, and that isn't performed at Black River Memorial. So there are things that definitely need to be shipped to, or situations where a patient would need to be transported to a tertiary facility, or sometimes even a quaternary center such as Mayo Clinic. But the vast majority, I think, situations are handled well. I think the additional advantage is that our patients have a physician that they know personally, that they've known over the course of time, that they know sometimes on a first-name basis, a face that's very familiar, someone that knows their medical condition. And I think that's a tremendous advantage, and one that I would look forward to myself in dealing with medical crises.